What is the future with COVID-19? Hello world, hello Boy Meets World. This is Dr. Lowell Sala of NYC Emerging Healthcare Technology, up for another episode of Health and Technology. Now, if you haven't subscribed, make sure to click that subscribe button and ring that notification bell so that you will be able to hear and see every time I upload a new video. Today, it is extremely special because we just reached 1,000 views and 93 subscribers. So if you happen to like this channel or like this video, make sure to click that like button and tell your friends to subscribe to this channel. So the question that we will be asking today is, what will the future be like with COVID-19? How will the world change? How has the world changed? Will we survive? Do we have the necessary skills and capabilities to survive this dreadful pandemic? What happens when the cold season begins? Will the vaccine come on time? And more importantly, how long will this immunity last? These are important questions, and the sad reality of this is that there is no clear answer, as everyone is still trying to grapple this disease. Understanding it may take a long time. We still do not have a definitive cure, so everything right now is focused primarily on prevention. One thing for sure that's going to happen in the near future is strengthening of the preventive medicine aspect of healthcare. For those of you who do not know, preventive medicine is a branch of medicine which focuses on the total well-being of the individual and not merely the absence of the disease. Preventive medicine is a branch of medicine which focuses primarily on the individual's total well-being in order to prevent disease, disability, and more importantly, death. According to the American Board of Specialties, preventive medicine is categorized into three subspecialties, namely general preventive medicine, occupational medicine, and aerospace medicine. Now, for those of you who do not know me, I am an occupational medicine specialist, and my medical practice revolves around helping institutions and corporations improve workplace safety. Occupational medicine specialists improve workplace safety by ensuring or by tackling hazardous environments. It is interesting to note though that the community right now has become a hazardous environment. So this next part is a personal story that I experienced, and this is something that I want to share with you all as my YouTube subscribers. So a few years back, a long time ago, when I was a young medical doctor, I used to moonlight in one of the one of the hospitals in Quezon City. Moonlighting means you work for a 24-hour shift in one of the tertiary hospitals. And it was fascinating because I encountered a patient at the time who was considered to have a diagnosis of meningococcemia. Now, if you do not know anything about meningococcemia is actually caused by an organism known as Neisseria meningitidis. And yes, you heard that right, Neisseria. Neisseria actually is the same organism that causes, gonorrhea, Neisseria gonorrhoeae. And or that's the genus and scientific name of that organism. Anyway, Neisseria meningitidis has a predilection towards what we call the meninges of your central nervous system. That is why one of the common manifestation or one of the common effects would be what we call meningitis. And it was interesting because at the time there was difficulty in terms of admitting the patient and making sure that everything is safe and protected. And it was fascinating because when I look at it back then, I really wanted to learn not just how to treat the patient, but how to protect myself and my nurses at the same time. And it was interesting because years later after that incident, COVID-19 happens, and this is something systemic. Everyone's affected, not just the hospitals, but all communities are affected, and not just third world countries, but even United States, even Canada, even Europe, for example. And coming from that experience, I realized that we are not really prepared to handle something as complex as an infectious disease that threatens to kill all of us. I mean, sure, if you think about it, there's a definitive cure for something as simple as meningococcemia, but for something, like COVID-19, something like coronavirus, basically, there's still no definitive cure. But one thing I realized, and one thing I actually learned from 4 years of undergraduate degree in microbiology and 5 years in medical school, 1 year of internship, 1 year of clerkship, and all the trainings that I've had, and 2 years of residency. One thing I learned is that the principles of infectious diseases, regardless of where you come from, whatever part of the planet, whatever part of the globe you come from, the principles of infectious diseases, the principles of isolation, the principles of prevention remain the same. And that is something that I want each of us to understand. The concept of washing your hands regularly, the concept of social distancing, all these things, these are necessary preventive protocols that have been done. And if you look at researches, if you time and time again, you look at PubMed, they will tell you everything that you need to know on how to survive in this really such a dreadful time. The concept of detecting infections early, separating infectious patients from others, transporting these patients properly, education of the patients and the staff, as well as designating responsibilities clearly and correctly, communicating with all the relevant partners. These things have remained the same. So in controlling the spread of COVID-19, we have things like administrative controls, which can be done locally as well as at the level of the country or at the level of the community. And then that's why we have policies for that matter. And then we also have your engineering and environmental control, and that is the purpose of your quarantine measures. And lastly, you have your personal protective equipments, which are essential, especially if you're the healthcare worker, especially if you are going through your day-to-day activities, and it ultimately reduces your risk of having or acquiring disease such as an infectious disease such as COVID-19. So another question that I want to ask of you right now is the significance of antibody tests. Is the antibody test, for example, or are all antibody tests essential or necessary? And this is extremely important because what if you test positive? What does that mean? For example, if you have an antibody test that tested positive, does that mean that you're completely immune to the disease in the future? What are its implications? If you're trying to apply for a job or look for a job and you did an antibody test and it tested negative or positive, what does that really mean? And if you're a physician working as an occupational physician, and the patient comes to you and you have this positive test or a negative test, what does it all mean? Does a negative test clearly state that you will not be infected with the disease, or that you won't get positive again? And knowing coronavirus something like 7 to 14 days, what happens if you get infected on the second day, on the third day, on the fourth day, on the fifth day, and right now you tested negative for the antibody test? So that's and looking at again on the economic aspect, how much will those antibody cost, and more importantly, what are the implications of those antibody tests? What does the regulatory authorities say? What does the World Health Organization actually say? So it's important to consider because the World Health Organization actually mentioned something, that at this point in the pandemic, there's not enough evidence about the effectiveness of antibody-mediated immunity to guarantee the accuracy of what we call an immunity passport or a risk-free certificate. People who assume that they're immune to a second infection because they have received a positive test result may ignore public health advice. The use of such certificates may therefore increase the risk of continued transmission. As new evidence becomes available, the World Health Organization will update its scientific brief. Which, if you look at it closely, it now goes into question as to what the vaccine really does and what type of immunity will the vaccine give. Will it be the same as having your regular flu shots? Will COVID-19 turn into a regular flu shot which we have every year? And will it be mandatory? Will everyone be required to have a mandatory COVID-19 So the answers to these questions are still up in the air. That we ask ourselves is that, will we survive? Do we have the necessary capabilities in order to survive? So in an article by the Los Angeles Times, Harvard epidemiologist Mark Lipsitch actually mentioned that there's with an estimated minimal intervention, SARS-CoV-2 would plausibly infect 20 to 60% of all adults between 1.5 billion and 4.5 billion people, even if it ends up being no more deadly than the seasonal flu, which is a highly optimistic assumption. Between 1.5 million and 4.5 million would actually die. And I think there's a lesson that's to be learned here, for every one of us involved. And other than addressing the fragility of the human body, today we also have the technology to make all those things bearable. I mean, we can now talk to one another with technology. We can do all these things that a lot of people during the 1918 flu pandemic were unable to actually do. And we also have the scientific method to help us address these things properly and on time, and hopefully we will survive all this. We just have to believe, we just have to hope and believe and have faith in ourselves and our capacity to be much more than what what we are. Thank you once again, and if you like this video and if you love to join me with these discussions, please subscribe and tell your friends also to subscribe to this video. And if you don't like this video, just like this video. So with that, thank you once again for joining me, guys and gals. Thank you so much for joining me, and I hope you join me next time. My new episode comes out Fridays, 10 Eastern Standard Time. And yeah, bye guys!